Okay, so good morning, everyone, and thank you for joining us for the BC Refugee Hub webinar titled Early Syrian Refugee Experiences of Integration in BC, Sustaining Welcome Report. My name is Bahar Taheri, and I'm project consultant with the BC Refugee Hub. For our land acknowledgement today, I'm joining you from the unceded traditional territory of the Coquitlam First Nations, which lies within the shared territories of the Tsleil-Waututh, Katzie, Musqueam, Cookite, Squamish, and Stolo nations. It's important for me to acknowledge the lands that I'm privileged to live and work on and raise my sons on as a way of showing respect and honoring the Indigenous peoples of these lands. Acknowledgement for me is a simple way of resisting the erasure of Indigenous histories and working towards honoring and inviting the truth. We would like to gratefully acknowledge the financial support of the province of British Columbia through the Immigration Policy and Integration Branch of the Ministry of Municipal Affairs. Today, your audio will be turned off throughout the webinar, so if you'd like to ask a question to our speakers, you can click on the Q&A box at the bottom of your dashboard. Please send your questions at any time during the webinar using the question box. You can also submit questions anonymously by clicking the option in the Q&A box. Questions will be read and answered throughout the panel discussion, and there's going to be plenty of time for questions with our panelists. You can use the chat box to share comments or resources related to the presentations during the webinar. For those of you not familiar with the BC Refugee Hub, here's a short background. In November of 2015, with the arrival of Syrian refugee families and to assist and empower individuals and refugee serving organizations to help in the resettlement process, ISSA BC, in partnership with the province of British Columbia, created this online resource hub called the BC Refugee Hub. The hub provides users information about refugees that are arriving to British Columbia, the latest reports, publications, statistics, and a variety of other information. We also provide webinar and training sessions like this one on a variety of topics related to refugees and refugee claimants. To receive updates, you can join our mailing list at bcrefugeehub.ca. You just scroll to the bottom and add in your email address. Today's webinar will focus on sharing the key findings from the Sustaining Welcome Report directly from the authors in a panel discussion format. For over 50 years, ISSA BC, the Immigrant Services Society of British Columbia, has been supporting refugees and immigrants in building their lives in British Columbia. The Sustaining Welcome Report is the latest example of ISSA BC's continuing efforts to understand the experiences and perspectives of newcomers so that they can inform settlement services and programs. I will now hand it over to Kathy Sherrill, Director of Settlement Services at ISSA BC. Kathy will be moderating our panel discussion today. So over to you, Kathy.
Thanks, Bahar. I'm just going to share my screen. Are you seeing my? Perfect. Thanks, Bahar. And I want to extend a warm thank you to all of you who've joined us today. Since 2011, over 6.6 million Syrians have been forced to flee their country in search of safety, and after more than a decade of conflict. There's another 6.7 million people who remain displaced within Syria today. In November of 2015, the Government of Canada launched Operation Syrian Refugee with an initial commitment to welcome 25,000 Syrian refugees to Canada in a very short period before the end of February 2016, a commitment which was later increased. Between November 2015 and December 2016, over 39,000 Syrian refugees were resettled to Canada through Operation Syrian Refugee. Of those, 4,400 refugees arrived in 65 communities across British Columbia through a variety of streams, including privately sponsored refugees, blended visa offers, referred refugees, and government-assisted refugees. This was the largest group resettlement in Canada in over 40 years, and it provided a unique opportunity to learn about resettlement outcomes. In response to this opportunity, the Syrian Refugee Integration and Long-Term Health Outcomes, or Syria LTH, project was launched. Funded by the Canadian Institute for Health Research, the project brought together a Canada-wide team of expert researchers to study refugee integration and well-being longitudinally. Researchers and collaborators contributed expertise from a range of disciplines, including psychology, social sciences, geography, and epidemiology. We ranged from professors in universities to individuals working in nonprofit organizations and volunteer organizations and members of the community. ISSBC was a key partner in the project, leading the BC research. And in my involvement, I'm the co-lead on BC, working with Dr. Jennifer Heinman. The Syria LTH members conducted 4 separate years of data collection on the same group of newcomers. Beginning in 2017 with 1,932 individuals, by year 4, 1,640 individuals across the country remained participating and had been interviewed across all 4 years. We also held focus groups to obtain qualitative information between year 1 and 2. The research itself was conducted in BC, Ontario, and Quebec. In BC and Ontario locations were chosen to reflect a range in geographies, including smaller and larger centers, as well as sites in all provinces where there were larger numbers of arrivals. Over the next 90 minutes, we're going to focus on the results and learnings from ISS of BC's most recent report, Sustaining Welcome Longitudinal Research on Integration with Resettled Syrian Refugees. This focuses on the BC participants, but does have linkages where appropriate to the broader community and to the national project. Our format today, to begin, each of our participants will be asked to present for about 5 minutes on different aspects of the report, followed by an open discussion among panelists, and finally we'll open for questions from participants. Throughout our presentations today and our discussions, I really encourage you to add questions as we go through to make this a more interactive event. So with that, I'm going to stop sharing. And I'd like to welcome Dr. Michaela Hinya, who's a professor at York University. And Michaela is the principal investigator of the Syria LTH project, bringing together and leading the project from its inception. So Michaela, if I can turn it to you.
Thank you so much. Thank you for the opportunity to speak with you. I am joining you from the traditional territory of the Anishinaabeg Nation, the Haudenosaunee Confederacy, the Huron-Wendat, here in Tkaronto, where the current treaty holders are the Mississaugas of the Credit First Nation. I am going to actually go a little longer than 5 minutes, but I warned everybody. So let me just share my slides. What I wanted to do today was speak to you a little bit about why we're looking at health when we're talking about integration. And it's because of a phenomenon that's called the healthy immigrant effect. It's been well documented that immigrants arrive in Canada with, on average, better health than the typical Canadian or the average Canadian. But that health advantage decreases over time, so that after about 10 years, they're on average, again, on par with the average Canadian. And there have been a lot of discussions around why that's happening, but there are 2 interesting points that I think we need to think about. One is that where we see the greatest decreases in health are in diseases that are related to poverty and stress, things like cardiovascular disease, diabetes. and that the groups that show the greatest decreases are those who have historically been excluded or faced more exclusion in Canadian society, those who belong to visible minority groups, or those who are migrating from countries outside of Europe. Those patterns have been interpreted in light of a social determinants of health model. This is a model that's intended to explain health disparities between groups. And it argues that some groups have better access to the kinds of resources and opportunities that lead to better material conditions of their living and working conditions, access to fresh foods, to safe places to exercise, and also experience greater or lesser amounts of discrimination and social exclusion. And it has been suggested that we need to look at the larger socioeconomic context and political context to understand how those conditions and how our various policies at the international, national, and local level shape experiences for different groups so that they end up with unequal access to these resources. Now, a lot of that has been applied to understanding the healthy immigrant effect, but what about refugees? It's been argued that refugees' health should actually improve following resettlement because they are typically coming from places where they have limited access to healthcare. They're often living in really dangerous circumstances. They're exposed to traumatic events. So on arrival to Canada, shouldn't things get better? Shouldn't their health improve? But it depends on how you think about what's contributing to people's health and well-being. There tends to be a focus on pre-migration determinants of health when we talk about refugee health and well-being. We tend to focus on pre-migration conditions, experiences of trauma, difficult migration experiences, and we really wanted to focus on the things that we can control. So what kinds of settlement services are available for newcomers? What are their post-migration living conditions? And what are the social conditions that they find themselves in terms of social inclusion and access to social resources? So how are the social determinants of health post-migration affecting the health and well-being of refugees? And the social determinants of health have been incorporated into a model that we use for understanding integration. It's called the holistic integration model. And those higher order social determinants of health, like the kinds of relationships that you have with people in your in-group, but also people in other groups and with powerful others that provide social capital that help you access resources. The extent to which the community is welcoming or you experience discrimination and the kinds of discourse we have around refugees. And importantly, institutional adaptation, the extent to which organizations and institutions adapt their policies and practices to make themselves accessible and to meet the needs of the various communities they're supposed to be serving. At what we call the interactional level are the things we often focus on when we talk about integration, your ability to speak the language, your familiarity and comfort with the culture, and what are called functional markers and means of integration, education, employment, income, and healthcare access. These are influenced by those social factors, but they are also influenced by and influence the subjective or personal integration experience of feeling like one belongs, feeling like one is safe and secure and at home. And that all of this is colored by the socioeconomic context that you move into. So it's important to know what's happening in each of the cities that people are migrating into and your social identity, things like your age, your gender, your religion, and your personal history, things like your level of education, or the kind of employment you had prior to migration. We tried to take all of those things into account as we looked at the integration pathways of newcomers, in this case, Syrian refugee newcomers, into Canada. And then we asked this question about whether changes in refugee newcomers' physical and mental health could be used as a way of measuring or documenting the success of the integration support and the integration pathways of those newcomers. I just want to give you a taste of what we saw across Canada. First, I would like to note that the the Syrian newcomers are not one unitary group. They came through different pathways and they come from many different backgrounds. And even those migration pathways are associated with different characteristics that might shape their integration outcomes. So there were differences in our sample between the government-assisted and privately sponsored refugees in terms of the average age of our participants, the size of their family, the level of education, whether or not they spoke English well enough or French well enough to be able to get their needs met without an interpreter, even how long they had been displaced, and whether or not they were Muslim or Christian. The key variable we were interested in, of course, was health outcomes, and we used a widely used scale that the free version is called the RAND-36. It's known as the SF-36. And as you can see, there are slight differences between women and men and slight differences between government-assisted and privately sponsored refugees. But I want to draw your attention to this red line. This is a tool that has been standardized on the average American resident. And the people in our sample in the first wave of data collection who had been here for 13 months on average were reporting levels of physical and mental health that were about on par with the average American. What happens over time? Using another, just a one-item self-report tool, we could see that for women, physical health maybe got a little bit better, but for men, at best, it perhaps stayed the same. And in terms of mental health, there was initially a dip, and then it sort of got a little bit better, but we actually were better off in wave 1 than we were in wave 4. And so the critical question that we want to be asking is, can patterns of integration help us understand what might be happening in terms of physical and mental health? And do they relate to this lack of improvement that we are seeing? You're on mute, Kathy.
It had to be someone. I'll take that one. Thank you, Michaela. We're going to turn now to Mahi Khalaf, who is currently the Senior Manager for the Resettlement Assistance Program and played a key role in British Columbia as the BC Research Coordinator for Syria LTH. Mahi?
Thanks, Kathy. Let me just share my one slide. Okay, thanks, Kathy, for the introduction. It's a pleasure to be with all of you here today. I'm privileged to speak to you today from my home in Richmond, BC, which is on the unceded traditional territories of the Musqueam Nations. As Kathy mentioned, I had the privilege of coordinating the Syrian refugee integration and long-term health outcomes study in BC between the summer of 2017 to the summer of 2020. I facilitated the project implementation in Metro Vancouver as well as in the Okanagan region. I worked closely with 8 amazing assistant researchers to conduct the annual interviews and focus groups that took place in 2018. I thought it would be interesting for you to start off by giving kind of an overview of the project implementation process in BC, highlighting some of the opportunities and some of the challenges that we faced, and how obviously we overcame those challenges. In year 1, we set out to recruit participants for the study. Given ISSFBC's role as the resettlement assistance program provider in BC at the time and kind of spearheading the Operation Syria, we were able to reach out to government-assisted refugees through mass texting to send out a call for participation in the survey and in the research. So it was relatively easy to recruit. There was a lot of interest, and it was relatively easy to recruit government-assisted refugees. For privately sponsored Syrian refugees, we utilized a slightly different recruitment technique, where we did some snowballing to try and get privately sponsored refugees to refer each other to participate in the study. We did the same kind of recruitment techniques in both Okanagan as well as in Metro Vancouver. We tried to include a diverse sample of Syrian refugees population in the study, and at the end, a total of 267 Syrian refugees participated in the study. The interviews were conducted annually during the summer month. Interviews were usually conducted in person at participants' homes, or also in public spaces such as libraries. During the last year of the cycle, basically 2020, the interviews was conducted through the phone due to COVID. For all 4 years of the study, participants were awarded either a monetary gift to show appreciation for their time, or for the last year, it ended up being an online gift card for a grocery store, just again to show appreciation for the client's time. On average, the survey would take an hour to 90 minutes. So it was important to us to really show that we appreciate that they have taken the time and they've committed to the study. The research team in BC was made up of assistant researchers. Majority of them were from Syria. Some of them are second-generation Syrians. Others were refugees or newly arrived Syrian immigrants. 2 researchers were Arabic-speaking from other Middle Eastern countries. Half of the assistant researchers were students or fresh graduates, while the remaining half worked in the settlement or the nonprofit sector in Metro Vancouver. Given the fact that ISSF BC is one of the major settlement agencies in BC, we intentionally had to distinguish between the organization role as a service provider, as a settlement service provider, and its role in kind of spearheading the study in BC. We clearly outlined the purpose of the study and the lead investigators' entities in the consent forms that clients had to sign. We also provided contact details for lead investigators to ensure that participants don't feel coerced to participate in the study. The consent form also clearly stated that participants can opt out of the study at any point, no questions asked. In preparation for our annual surveys, these are large, long quantitative surveys. So in preparation for them, assistant researchers were trained annually to administer the survey. The trainings were usually done in collaboration with the national team, as well as also within the BC team. Researchers were trained on maintaining boundaries and ensuring that, again, there is a clear distinction between ISS's role as a service provider and its role in leading this research. We were also training our researchers to enable them to respond to questions, basically relating to service delivery. All of us as researchers spoke Arabic. Participant felt, with time, felt very close to us in a way. So they would ask questions relating to settlement service delivery, or questions relating to accessing healthcare, or even as simple as asking researchers to read some of the letters that they receive. So we had to really be to train everybody as researchers to be obviously kind and supportive, but at the same time distinguish that our role for this hour or hour and a half is to mainly go through this survey. I guess I wanted to share with you some of the reflections on the data collection process. As you know, as a researcher that was involved in the kind of the data collection annually, you know, it was a comment that I got back from the whole team of researchers, that it was a privilege to be involved in and to be invited into participants' homes to conduct the surveys. For me personally, as one of the researchers, I felt that I had a rare opportunity to witness the progress of participants' settlement journeys over the year. You know, it's from the simple stuff, you know, even seeing how their homes change. You know, from one year to the next, you would see they would add photos, kids' photos in the school, and just their new life in Canada. You start seeing it reflected, but also things as simple as dropping more English into the conversation, you know, from the first year to the second year, and third and fourth. So it was really, really a privilege to be able to witness that and to be invited into participants' homes. With all of these amazing kind of opportunities of interacting with the participants annually, came the challenge of you know, some of the questions tend to touch upon topics that can be triggering for clients, as well, honestly, as the researchers. So as a result, we had to initiate on an annual basis self-care trainings for all the researchers. We also had to train them to deal with like hearing some of these issues that are coming up, and also making them feel that, you know, we can stop the survey for a while until everybody regroups and comes and is able to come back. I just wanted quickly to reflect. I thought would be interesting to reflect on the qualitative side of the research, which is the focus groups that were organized in BC in year 2. We had 4 focus groups organized, 2 in Okanagan, 2 in BC, for women and men separately. It was an amazing opportunity to bring participants together to collectively discuss their settlement journey and reflect about their successes and challenges. It was also an opportunity for participants to share with the group their experiences and to realize that they have shared common challenges. You know, it was for me also somebody who worked in the front line and worked as a settlement worker at the time. It was an amazing opportunity to see clients reflect on their lives, rather than hearing it from the perspective of needing services only. I think I will stop there and hand it back over to Kathy.
Thank you, Mahi. Our next panelist is May Masije, who is a Syrian Canadian whose role in Syria LTH was broad, ranging from helping to develop the surveys, data collection, and outreach in Toronto. So May, if I can turn it to you.
Yes, thank you so much, Kathy, and thanks everyone for being here with us today. I'm joining you from Toronto, also known as Toronto. Today I'll touch a bit briefly on the experience of data collectors during the Syria LTH project. From a lived experience, being from Syria and having arrived a year in that same year as the project was also developing, that gave me that gave me such an insight around what does community engagement and project design and research design look like. The group of us, from our lived experiences and from our culture, like the cultural knowledge that we have, being from Syria, we were able to engage in the development of the questions as well, and touch a little bit on the. I'll talk a little bit about the translation and the importance of translation here. I think this is something that the research was like knew how essential the translation was for the community members, but as we've dug, as I guess we continued working on that piece, we've discovered more and more how important paying attention to every word, or however, like whichever word that we are using in the questioning, is very important to how the I guess the community member is receiving that question. So through a lot of ethics sessions and a lot of translation sessions, we were involved in translating the survey, paying attention to how do we translate it, keeping in mind that Syria has many dialects, and there should be a balance between those dialects as well. So at the time we decided on traditional Arabic, with the translation being into a general Arabic through the I guess the survey whenever the survey is collected. I also want to touch a bit about the fact that we as researchers, or personally myself, I did have that feeling of us being the first bridge between academia and the refugee at a time. Most of the folks that we spoken to, they did not have that engagement or encounter with academia in the past. So the fact that we had some of that knowledge about how to communicate with them, the training that we got through the project about what our roles are, the boundaries, as Mahi was speaking earlier, and the opportunities that exist that we can extend to them as well, was essential for the data collection on our part. Some of the other considerations here also are the balance, or I guess are prioritizing ethics, but keeping in mind the cultural consideration of the community that we were working with at the time. So things like accepting tea, or having to chat about someone's family, or those are things that are quite cultural that we had to engage in, while keeping in mind that it is a research and our involvement should be approached from a research perspective. And also the fact that the connection between us and settlement, or between the researchers and settlement, should not, I guess we were giving a list that we handed to the participants in the study that had this all of the services that they would need, including access to health and so on. And I feel like that kind of showed that our intervention was not a one-off, but also considering the well-being of the community member while collecting the data as well. I guess knowledge mobilization was a big piece of the research, knowing that the community members were able to receive some of the feedback about the project and what the project concluded. I would think it was valuable for them as well. And I think I'm gonna wrap it up here. Kathy, I feel like I covered the points that I needed to cover for this.
Thank you, May. Fabulous. So what we're going to do now is we're going to shift from talking about the Syria LTH project at the high level and about the experience and really the considerations that were taken into account as we did the research, as we did the work and the iterative process. We're going to shift now to Dr. Yolanda Wima, who's a postdoctoral fellow. And Yolanda came into the project specifically within British Columbia. And she has been responsible for analyzing the BC data and preparing both the Sustaining Welcome report and an article that has been submitted for publication that will come out of this. So, Yolanda?
Thank you, Kathy. So I am just sharing my screen. I'm going to be giving a flying overview of some of the data from our report, specifically on BC, but that also drew from the many really rich publications that came out of the Canada-wide project. And there's a lot that I'm not going to cover, but there's much more that you can see in the report. So regarding language, there was substantial improvement across the 4 years for participants in BC. As you can see in the chart here, year 1 is on the top with men and women, and year 4 is on the bottom. In the first year, 34% of people always required translation, and in the 4th year, 19.4%. So about 1 in 5 still always required interpretation. But what is really interesting is in a question that was asked annually, ask people to cite their own experience of success. Language was one of the most frequently, in BC, it was the most frequently cited success for participants, that they were improving English, that they had gone up a level in Link, that they were able to do more, or simply things like learning English every year was the most frequently cited success. We do see some kind of gendered barriers related to language, and that more women still than men require interpretation in year 1 and still in year 4. This is important related to what Michaela was discussing, as language is interconnected with so many aspects of integration, like employment and like social connections, which was also discussed by focus group participants, the importance of language, but the way that it also facilitated so many other things in their lives. Regarding employment and income, more participants found employment every year of the study. And in BC, we saw 15% of women participants employed in 2020 and 70% of male participants. 40% in BC were essential workers during the COVID-19 pandemic, making really important contributions, I think. But also in year 4, we saw that about 40% of participants reported social assistance as a source of household income. Just going quickly still, all of the focus groups discussed the challenges of the needing to start from scratch when it came to employment, not having prior experience and education recognized, and the challenges that this created for them. The largest proportion of participants found work through family and friends, and participants who had relatives in Canada and social connections with people of other ethnic communities were most likely to be employed within the Canada-wide data. The focus group kind of echoed the relationship of employment to other factors. So they echoed this kind of holistic perspective. They said that employment is important to forming social connections, making friends at work, especially bridge building at work. Also important to language learning and mental well-being. So while social connections are important to finding work, work is also important to creating social connections. While language is important to finding work, work also facilitates kind of everyday colloquial language learning, and that work can be very important for mental well-being. So moving on to social connections. This just is showing percentage of friends by sponsorship pathway in BC in year 1 and in year 3. We see that in the beginning, BVOR and PSR sponsorship had were more likely to have more friends, but that this kind of in year 3 had evened out largely. While the percentage of friends doesn't necessarily say a lot by itself, it's also interesting to add to this that in the 3rd year, 28% of women wish they had more friends, and 34% of men wish they had more friends. So we can see this kind of change over time. And I think this is something that'd be interesting to learn more about. But I'll move on to mental health and well-being. This chart here is just showing for Metro Vancouver the rates of depression level symptoms according to the PHQ-9 data in year 1, 2, and 4, showing mild in kind of the deep purple and moderate or severe in the green color there. And we can see kind of an increase over time in terms of people with depression level symptoms in Metro Vancouver. as Mikhail discussed, that the post-settlement experiences are important. And nationally and in BC, participants reporting clinical depression level symptoms increased after the first year of the study. Regarding linking kind of things together, and linking employment, income, and mental health. So one of the focus group participants, as I said before, discussed this. She said that to her, working is a relief. And even though that it can be tiring and stressful to go to work, going out and working can lessen the stress. That unemployment, in the Canada-wide study, they found unemployment increases in individuals' risk of moderate or severe depression. And this is also true in the general Canadian population. Among resettled refugees who are employed, whether or not their income is adequate was a significant predictor of mental health in the Canada-wide published results, and that poverty is a significant determinant of poor mental health and a significant source of stress for resettled refugees. And an interesting additional finding in a paper from the study was that the perceived appropriateness of their work was also very significant especially for more highly educated participants. And I think that this was also seen in the focus group discussions regarding having to start over and start from scratch, regardless of their background, whether it was welders whose experiences weren't recognized or psychiatrists. And then moving to my last slide, social connections and well-being. So having few friends was associated with the risk of depression in the first 2 years of the study, just when we're looking at the first 2 years, and that social isolation was linked to poor mental health outcomes also in other studies. Both the men's and women's focus groups echoed this, and they echoed the importance of making time to be with others, but also the difficulty of that in the busyness of life in Canada. That people between work and taking kids to school and watching kids and language classes, that finding the time, especially if you live far from other people, can be difficult. And I'll just give a minute to look at these quotes from the focus groups, that in the women's focus group discussing the importance of the cup of coffee that you have with friends and the emotional support that gives. And in the men's focus group, one of the quotes that I pulled out was how, given difficult experiences that people were living through, they wanted to emphasize the importance of being able to discuss it with others. So I am going to stop sharing my screen. And I won't be able to discuss all of the other interesting findings, but hand it back over to Kathy.
Thank you, Yolanda, for that succinct, and certainly interconnected outline of the findings. And my apologies for mispronouncing your last name. It's Maima. So finally, I'd like to introduce Dr. Jennifer Heinemann, who is a professor at York University and the Associate Vice President of Research. Jennifer is the co-lead in BC with me, as well as helping to guide the larger project, and is going to tie all of the threads together from our panelists. So Jen, I'll hand it to you.
Thank you, Kathy. And I too come from Toronto, also known as Toronto, to you today. And it's great to be here. I'm not sure there's a whole lot more to add to what's been said. I've been taking notes and being reminded at what a fabulous project this has been to be part of. I wanted to just make a couple of points that I think have been beautifully presented already. But I think this is a project that stewed around among some of us for several years. In 2014, I remember having conversations about a project like this, but finding the funds, the people, the person to hold the pen. I'm going to look at Michaela Henia and thank her for taking that leadership role. Being able to collect stories with the same people over time, as Michaela mentioned, that longitudinal research opportunity is a very rare one. And I just wanted to say that I think that allows us to say really important things. Like Yolanda just mentioned, that and showed us in the graph that mental health, for example, can actually go down after people arrive here, and that we really need to be on our toes and think carefully. You know, settlement is not just, certainly never was a one-year commitment, but ultimately integration, well-being, health, all of those things can actually decline after what might be called the honeymoon period or something like that. So I think we really have the opportunity in this study to kind of trace and pull that thread through in ways that all of the presenters so far have been able to do in different ways. There really is so much in this report that it's difficult not to cherry pick and pull a few pieces out. I'm going to make a few more comments a little bit later, but I know we would like to get to Q&A before too long with the audience and make this more interactive. So I'm going to leave my comments here, and I'll get back to everyone very soon. Thanks.
Thank you, Jennifer. So as we bring back all the presenters, not just highlighting me on this, what we'd like to do is move into some open discussion. We've got some questions from participants through the registration, but would really encourage people who are on the line today to submit your questions to make it more interactive. So I'm going to start with a high-level question about the research. You know, as Jennifer said, this is a big project. It went over 4 years. It is, I think there was 267 questions on the first interview. So to give you a sense of how much information. What do you think when you reflect back on the last 4 years, when you reflect on the data, what do you see as the most important contributions of this research from your perspective? And are there learnings that may help future resettlements of large, or insights for settlement service programming?
I can go. So for me, I think the longitudinal nature of the research itself is very important and key, as it follows the same group of Syrian refugees over the 4 years and continue to ask more or less the same questions and see how things are, how the settlement journey is going. To me, that is, it provides amazing insights to the progress of refugees, as well as also insight into settlement programming and, you know, what is going well, what is needed, what do we need more of, what do we need less of. So for me, that was one key important thing, like basically the repeating over and over for 4 years is key.
Great.
One quick point, a little more of a high level point, but I think one that that comes to mind is just the kind of moment where civil society and government and media messaging all came together. It's sort of, it was rather rare up until the Syrian Operation Syrian Refugees. I think it was probably the comprehensive plan of action, or the exodus of Vietnamese, Cambodians, and Laotians way back in the late 1970s and early 80s, since we had such a surge of support, such a kind of unanimity and coming together of all those actors. And I think we had, there were other moments with the Kosovars. Kathy knows that well from her own research, but Idi Amin pushed many people out of that country as well. So there were moments along the way, but I think the Syrian, this project and this moment allows us to kind of witness how a particular cohort of people, to Mahi's point, we talk to the same group of people every year for 4 years, which is sort of unheard of and blows my mind, frankly. But that we can kind of come to understand what those bigger roles of of support at our end. And given what Michaela said about the holistic integration model, it's on us as a Canadian society and government to figure out how best to receive and welcome and bring into and make part of our communities this group. So from a very high level, I just want to say that I think that's an important contribution of the report and of the study.
Michaela.
There was some really interesting work done in a couple of areas by some of the other people on this team, where they tried to compare the different provinces around access to language classes. And I think one of the things that I always thought was really interesting about this project is that there are different policies around how services are delivered in the different provinces. So it wasn't just that it was longitudinal, but it was also comparative. And what it allowed us to do was ask whether different models of, in this case, for example, language provision, create barriers, additional barriers for people accessing those language classes. So we saw that there were barriers around accessing language classes that were related to gender, related to employment, so that people who actually had a job had to choose between going to the job or going to their language classes. And you could look at how the policies in the different sites either created more access or less access to essential services through the settlement process. I think there's still a lot more to be looked at, but to me, that was really valuable because we rarely get to make those cross-policy longitudinal comparisons.
I can add, if I can add just my hat as a kind of senior manager for the resettlement assistance program, and the fact that we're engaging kind of at the end of the Afghan initiative. I see this methodology being very relevant in kind of studying mass migration in general, regardless of the population. The challenges that the refugees, regardless of where they're coming from, are the same. The challenges when they arrive in Canada are the same. So I see it would be very interesting to kind of have another such project to looking and examining kind of the resettlement of Afghan refugees, and will give you, I think it would give us really interesting data to compare across different refugee populations also.
If I can take a moment and add in, for me, I think one of the things is when we talk about integration in Canada, we talk about definitions that have been created by policymakers, by Canadians, and imposed on others. And for me, that emphasis on, and there's one question around what's a success mean to you? What did you celebrate? As we started to really see how newcomers felt, what was success to them, rather than it being measured according to factors determined by others. And I think, when we looked at some of the results and you see talking about some of the negatives, so, were there instances of prejudice, and Islamophobia? Yes, but what we also saw is this real emphasis on people learning about Syria, people learning about Syrians, and really modeling that two-way model of integration. So to me, what's the most important thing that came out of this is really seeing that integration in action, not just how newcomers were changing, but also how Canadian society. And I think that stands for me as something that is unique within this project. So I'm gonna mix a couple of questions in here from participants, but I'm just going to, one of the things about any research project is we do our best to overcome any limitations, but I think it's important to ask, what are the limitations of this research or of the report itself? And on the other side, do you think that there's issues that emerge that warrant future attention and future research? So maybe we can start with Yolanda.
Yeah, thank you. It is a really interesting question because, I mean, all research has limitations. You can only do so much in one project. And I think that some of the questions that I received about the report earlier were related to comparisons with the general Canadian population or comparison with groups like the Kosovars who arrived earlier. And this isn't a project that's explicitly comparing those groups, so it's very hard to kind of take that out of the data. So yeah, I would say that those are kind of necessary limitations of the types of specific questions that were being asked in this project. It wasn't those types of questions. I'll hand it off.
Taylor, did you want to add anything?
Yeah, I think I just want to build on that, which is that, what happened with the Syrian Resettlement Initiative was very different from what was happening with resettlement before. And I had been doing a lot of work looking at integration and health and well-being across a number of different communities in the years leading up to this project. And what really struck me about the Syrian community is that they were coming from what was a middle-income country where the conflict had exploded relatively recently, where they spent relatively little time in displacement. And so many of the characteristics of this community are really quite different from what we have seen with other people who are resettling through humanitarian pathways. And because of my own training, which is very, very much in cultural psychology, I think it's really important to understand the specific experiences of the group that you're working with, the kind of lifestyle that they had prior to coming, what they expect when they get here. One of the findings that was really powerful in this research was what happened to people who came with university degrees, who were physicians, who were engineers. When you compared you were more likely to find work if you were highly educated, but the likelihood of making more than minimum wage for a person with a university education was exactly the same as that for somebody who had less than 9 years of schooling. And so we saw that the level of distress experienced among people with high levels of education was greater than that of people with lower levels of education, as they saw their dreams and their hopes for the future shattered. And they began, I remember actually one of our peer researchers saying by year 3, they're more settled, but they've lost hope. And so the opportunities that are available for people really shift as a function or have to be taken in relation to what their expectations and hopes were, the kinds of opportunities that they expected they would have on arrival. And that is different from group to group to group. So yeah, generalizability is a huge issue. I think we need to really think carefully about the context for each group that we work with. At the same time, I'm now bumping to the next question. I'm sorry, I'm talking too much. But at the same time, I think that we can think more broadly about, well, what are the kinds of things or the more generalizable pieces of this work? And they are things like you have to consider what people's hopes and expectations are, and that's how we understand the impact of their experiences. That we can still talk about the importance of social relationships, but that these are going to be formed differently for different people. So the higher order principles of expectations of social relationships, of people's long-term goals are something that can still drive our work and that we can gather understanding of from this sample because of the longitudinal nature. It also allows us to explore the complexity of people's experiences, but we also need to keep in mind that we're talking about a particular moment in time in Canadian history for a particular group of people.
So if I can add in, we've got a question from one of the participants. Since the research focused on certain newcomer groups within a time period and a specific settlement frame, how do we evaluate the experiences of new Syrian refugees between 2021 and 2023? Do you think the changing economic and social conditions in Canada might have influenced new Syrian refugees' experience and research outcomes? And I'll just add in, and perhaps you could speak to how Syria LTH is considering this. Always open to everybody.
Yes. I think a central part of our model is that you can't talk about the experience of resettlement without considering the socioeconomic context that people are settling into. One of the things that was interesting is Windsor, which is one of our sites, actually at the beginning of the project had perhaps the most challenging socioeconomic conditions in terms of employment and income. And by the end of the project was actually doing much better relative to the other cities. So the fit between the kinds of employment that are available and what people are looking for and whether they're looking for employment is going to be determined by the community who's being resettled, by the individuals within that community and their previous histories, but also by the context they're settling into. As there are fewer jobs, there are fewer opportunities. Of course, that's going to affect the people who are resettling. So again, I think we can think about some of the patterns that we're seeing, and then think about how the current context would play out given those patterns. And just yeah, I'll leave it there.
Anyone else want to jump in? So let's go to another one from participants. So where do we go from here? How will these research results impact planning? Not only, for example, for IRCC related settlement services, but also for mental health planning, newcomer health interventions, etc. And as an add-on, how confident are you it will impact future positive change? Maybe I'll kick this one off. All right. I think one of the things that for me really came out of this project, when you look at what are the implications around, for example, service provision, and for those of us in the province or across the country who are IRCC funded, we know those proposals launched, so it's top of mind. It is really the need to look across the varying issues. So quite often when we look at programming, we think about if somebody is depressed, if there's mental health struggles, concerns around well-being, we think about mental health programming. And we talk and we advocate around the need for clinical programming. But I think coming out of this project for me is that real emphasis on mental health is, someone's mental health is impacted by a variety of things. It can be around belonging, so those social connections. It can be around employment. It can be around language, accessibility, and so as we look to IRCC, I think it's really encouraging people to look at the findings and to think about what that interplay between factors and between results is, and to use that in our programming. It's not quite that straight line to we need counseling. We need a range of supports that are psychosocial informed.
And just to add, with an awareness that there's still a need for these supports in first language where possible, just given that maybe participants are getting proficient in English, but again, expressing your innermost feelings will be much harder in English than it is in first language. And also, just to tag along, is around long-term services. I think the thinking is, once refugees come to Canada, within 2 years, they should be off and running, kind of everything should be great for them. But the reality is it takes a bit longer than that. So how much longer can we continue to support refugees, especially high need ones, beyond those 2 or 3 years?
And I think even when we look at the broader, so taking it above settlement services, the interim federal health program is for the first year. And, you know, one of the things that the federal government is doing right now is a pilot for some Afghan arrivals who have come in the last 2 years around extending those mental health supports under IFHP into a second year. And I think, you know, to Mahi's point, it's also looking not just as what do service providers do, it's looking at asking the question from the federal level, from the health, provincial health, it's around how do we ensure supports are in place that are in first language, that address mental health, because a certain percentage of individuals will require clinical counseling. So looking at how do we create that bundle of services and supports for people to ensure they have the best opportunity to integrate into Canada.
I'm just going to add here. Oh, sorry, Michaela, do you want to go first?
No, I was actually going to ask you a question, so you go.
So I think the fact that the survey as well, I mentioned this already, but it was the first encounter between, or most likely the first encounter between academic research and the participant, but it's to an extent it was also the first encounter of terminology related to mental health and participants. So there we saw a lot of the I guess curiosity, but also a little bit of the pushback in the first couple of years, or the first year of like, you know, I am not going to answer, you know, this question, or I'm not going to answer, I don't feel like this question on the scale applies to me, to like maybe closer to like second or third year, where people started to like kind of feel more comfortable talking about terminology that would be quite taboo in Syrian culture in the past, or would be topics that would not have come up in the past. So I feel like that in a way, I think the person's question is about where do we go from here? And I feel it just like the fact that research is not just doing that research to collect, but also to kind of communicate and build that connection with the participant as well while it's doing that collection. And that would be something to hopefully see forward in other research as well.
Yeah, now you've got me wondering about whether the changes in mental health are just greater comfort in disclosing or actual changes in mental health. So back to that generalizability question and limitations of the research, I've got a big red, you know, alarm button going off over my head. I actually wanted to just say one other thing about where do we go from here. And I'm going to maybe put May on the spot here as somebody who's been, you know, in a lot of people's homes, Mahi as well. And that is how people are impacted by what's happening to other members of the family. And I wonder if you could speak a little bit about how people's health, mental health, or other opportunities are shaped by what's going on in their household with other members of the family, because I think that's a thing that I really learned from this that I hope we take forward.
You want to start, May?
Sure. I think to your point, Michaela, it's not yes, what's going on in the family, but what's going on in the family outside of the household too, right? Like we saw a lot of the comment and a lot of the questions that we would get after we asked the questions through the surveys, like how can I bring my mom, or how can I bring my father, or how can I make sure my sister is here, and that was a very much reoccurring theme. So and I'm sure that showed up in the survey as well when it comes to mental health and the impact of family reunification and mental health. But yeah, like I think the fact that we were in people's houses, what was going on at the time, whether like there's a child somewhere or whether there's some kind of distraction, of course, would influence. You try your best to like make sure that the environment is fit for conducting a survey, but of course there's always something going on. So yeah, so I feel like those all considering like the factors within the household, but also refugees will always be a global citizen, right? Like they all have families abroad, they all have families, whether it's in Syria or other places in Europe or, you know, all over the world. So they will will always be considering what's going on somewhere else while they're considering their questions or their answers to your questions.
Yeah, for me, I actually have a really clear example where I remember going into one participant's house near one, and the conversation after the survey was all about what are the resources, how can I bring them? They are already, registered with UNHCR, and having to kind of talk about the different kind of the streams that they can come through. And then fast forward to year 4, and they were going to go get their family from the airport, and that was over the phone, and you could just feel the energy, like a complete shift in that person's energy and voice, just by realizing a long dream of reuniting with family members, which is very taxing. You're not only are you stressed out about your new environment in your new country, but you have a sense of what I was told more than once is, I feel guilty that I'm here, but they are not. So it's a very, very it would impact anybody's mental health well-being for sure.
And just conversely, that having extended family in Canada can be a substantial support to people in what they're going through. So the separation can be a source of distress, but having extended family is a source of support.
So one of the questions I want to acknowledge from participants is, how does the data around refugee claimants as opposed to GARs and PSRs impact this research? I noticed the stream was not included in the participant group, and I'm wondering how the decision was made.
Yeah, I can answer that. So there's a couple of things about studying refugee claimants. One is that if their claim is not accepted, they're no longer present in the country. They're typically asked to leave. So it can be quite difficult to follow refugee claimants over time, because refugee claimants may or may not be successful. I think the other piece that is challenging is that we wanted to do this study in one language. I have done projects where we have used as many as 9 different languages, and May talked about how difficult it is to do appropriate translation. I want you to imagine what it was like having to do appropriate translation in 9 different languages with peer researchers from all of those different communities simultaneously. So working with one language at least allowed us to be absolutely certain that the materials that we were working with were appropriate, both culturally appropriate and linguistically appropriate. The other thing I would say is that refugee claimants typically come to Canada, although we've seen a lot of people coming to Canada through border crossings in the last few years for a variety of reasons. Most people arrive in Canada through a visa program of some kind and then make a claim after arriving. They are very different as a population from resettled refugees. So it's very difficult to make comparisons between them because they really are very different populations. There are unique challenges facing refugee claimants in terms of their precarity and vulnerability, but also the resources that they have available to them. And so while I think it's really important to also do work on refugee claimants, I think you want to do work that's deep and rich. And so you want to do it properly and recognize that if you were doing something with refugee claimants, you'd be doing a very different kind of project.
Thanks, Michaela. So there was a brief mention about the different newcomers, Muslims and Christians. Were there any key differences in the long-term experience for each of those groups?
I can actually say there was a small difference but it's really, we tried to statistically control for different kinds of variables that might explain differences between groups. It's hard to draw conclusions because many of the privately sponsored refugees were coming to join the Armenian community and were Christian and also Armenian. and also typically came from a higher educational background. And so everything about their experience was actually quite different. So it's hard to draw any strong conclusions, but we did not, the one thing that we saw that was slightly different was that again, not clear if this had anything to do with the religious background, but our Muslim Canadian samples actually reported feeling a greater sense of belonging and some more positive experiences than what was happening for the Christian participants. But whether that was because of where they were settling, which community they belonged to, and which pathway they came through, even if you put those in statistically, I'm not sure you can remove all of those effects. So I would say I don't have a lot of confidence in any differences that we observed there.
Okay, so we have about 10 more minutes, and I want to leave 6 minutes at the end for one final thought from each of you. One of the questions that came up when we've talked about this in varying parts is, given the important benefits of employment that have been identified, not just for income, but also overall well-being, what do you think are the most important things we can do to enable this, both from a service provider perspective, but also on the part of employers?
I can answer that from my settlement experience in the last. So I'm working with Afghan women organization in Toronto right now, and I think, not to generalize the findings on the Afghan population as well, but what I've been finding, even working with the Arabic speaking refugees and immigrants, is what really matters on behalf of the employers is the flexibility when it comes to being mindful of people's complex experiences. And with that comes the fact that maybe what you're going to do is offer additional accommodation in your workplace. So whether that's language training on the side, or additional support for that person's family and a family situation, but when you're taking in someone, you're also taking in a lot of experiences and a lot of things that they can extend to your workplace as well. So it's not only you who's accommodating, but in reality, by you extending, you're getting the benefit out of having that person working with you at the same time. But I think the flexibility on behalf of the employers is very crucial, and for them to honestly, maybe even read about what people can face when it comes to their life experiences. If you're having someone in your workplace that's a first-year refugee, maybe read a little bit about that, and what if they have their mom living with them at home. Maybe if their mom is sick, they're probably going to end up staying at home. Are you able to accommodate for that as well? So keeping in mind that you are taking in people with their complex experiences, and having those accommodations, which, from an equity perspective, they're not accommodations, they're just you making your workplace accessible for everyone. And I think those are probably some of the considerations to pay in mind when it comes to working with refugee population with employment.
Thank you, May.
I guess from a settlement service provider's perspective, what I find very helpful is to continue to communicate and work closely with employment programming to give more awareness around the not just the needs, but or the challenges that face refugees, but also the opportunities that they bring into the table. I find that when we do that, we open our space to teams to communicate with each other. It really helps with whether, through within ISSFBC or even across agencies. It really is benefits at the end of the day the refugees or the clients that we support, and increases their chances of getting appropriate and good employment opportunities.
So I want to, Yolanda.
I was just going to add around the gender difference in employment. I think affordable childcare, as long as there's not affordable childcare, I think it will keep many people out of the workplace. which is a broader policy issue, but equally then considering what options are there for people who are staying home to still have kind of largely doing childcare, to still have some kind of engagement with work, whether it's work from the home or with other people in other ways, would be something to think about and consider.
Thank you. So as we draw to a close, we've got about 8 minutes left. There's 5 of you, so 1 minute each. I want to return almost to the beginning. The report itself is entitled Sustaining Welcome. When we look back to the beginning of Operation Syrian Refugee in the fall of 2015, public interest in Operation Syria was high. Canadians from coast to coast to coast, and that's individuals, corporations, small and large businesses, came forward donating money and goods, volunteering their time to help welcome newcomers, offering housing and employment. We saw some businesses locally within BC. Van City stands out to me, introducing zero interest loans to help people convert spaces to housing for refugees. Yet the focus has waned over time. And when we think about what we've talked about today, what we read in the research about the importance of those connections, the social networks, my question as we end is, how can we best sustain the welcome?
I can start. I think for me, it's building on existing programming. You know, like there's no need to reinvent the wheel. There's actually quite interesting and innovative programming that is happening. Off the top of my head, I think one of the most successful would be the Volunteer and Community Connection, the mentorship program. It is one of the most interesting programs that brings together longtime Canadians and newcomers and creates this amazing friendship that, you know, I think one of the images the images, I guess, that stick to my head quite a bit was in one of our focus groups, where one of the women talked about a relationship that she's established with an Indigenous First Nations friend who kind of adopted each other into each other's families. This is, you know, no matter how many workshops that we can do about truth and reconciliation, you cannot beat having that kind of interaction where people are building relationships and connections on their own, and it's growing organically. So it's basically building and supporting these kinds of programs and increasing awareness and keeping volunteers motivated and interested in joining different settlement agencies to support newcomers, I think would be a way to sustain the welcome.
Thank you. Okay, 1 minute. Yolanda, Michaela, Jen, May?
I'll jump in. As an academic, it's perhaps a little cliche to say, I think another wave of research would be great. But ultimately, you know, what happens, you know, 6-7 years after people arrive? I think we need to know more. And this kind of research really is expensive. So I noticed in the chat, there were a couple of questions about have other groups, is longitudinal research being done with other groups? And there is a little bit of research that the government collects in the form of income tax filings and things like that. But in terms of health, integration, well-being, how's it going? I do think this project offered a window into worlds, and I still struggle with whether it was a survey or an interview that happened with each person, but I do think research plays a role in keeping the question going. How do we sustain the welcome? I don't think we know, but I think the onus is on those of us who do research to keep finding out.
So can I just throw in a comment as well? You know, one of the things that I've really been thinking about is how often we frame refugee resettlement as a charity, and therefore not a requirement. and that the way we try to motivate people to participate in sustaining welcome is by getting them all worked up emotionally, when we know that people cannot sustain that kind of emotional engagement. I think we need to rethink how we approach humanitarian resettlement, away from a charity framing and away from just trying to get people to do it out of distress, and get them to think about doing it as part of their everyday life. How do we build welcoming and including and supporting people as just something we do, make it easy, make it something we do without thinking about, and therefore something that we can continue to do and we don't burn out doing it.
Thank you.
I think you sustain welcome by, I guess only having one door rather than multiple doors that the person has to go through in order to make it into your house. So if they have to like open up the first door, but then they have to like pass through a second door for employment and a third door for this. And so basically removing barriers in whatever sector you work with or you work from, considering bringing on that lens of access to your work and opening up another door for someone to, once you're here, maybe you don't have to like continue knocking and climbing onto the house and maybe having to go from a window into the, to access mental health as an example, or like to access a service that you really need. So just making sure that we are taking down some of the barriers and some of the challenges that exist for people who are trying to make a life for themselves over here.
Yolanda.
I was going to say, in terms of sense of belonging in the study, they did see that more and more people felt more sense of belonging to their neighborhood, city, and to Canada over time. And that shows that there is kind of a sense of belonging that is increased. But in terms of sustaining welcome, I would look at the data on discrimination, which was collected for 1 year, and the amount of participants who reported having experienced discrimination, which was also discussed in the focus groups. And I would think part of sustaining welcome in the long term would be being attentive to that within the broader Canadian society, which does change over time as kind of the broader discourse changes over time as well.
Well, thank you, everyone. And thank you to those of you who have joined us today. I promised to get you out on time, and it's 12:29. A really big thank you to Yolanda, Michaela, Mahi, Jennifer, and May for joining us today and for sharing their insights on what really has been a remarkable experience, I think, for the researchers and for participants. I hope to see more of this in the future, but thank you to all of you for joining. Thanks. Bye-bye.